right. So I'm going to go ahead and get started. Thank you all for being here. We really appreciate it. This is MiCDA, the Michigan Center for Demography of Aging's first annual Schoeni lecture, Trends lecture, and I am Sarah Patterson. I'm one of the Core C Communications co-leads for MiCDA. So I'll be kind of giving you an introduction, then Mara will talk. Neil will join us online, and then we'll take time for Q&A at the end. If you could hold your questions to the end, that would be best. If you're online, you can type them in during the course of the talk, but they won't be read out until the end after everyone goes. So just to give you an idea of who we are, MiCDA is accelerating research on aging in 3 particular areas. So our first piece is enriching data infrastructure and methods to promote breakthroughs in the demography of aging in particular. Then we have a changing demography of late life disability, dementia, and family caregiving focus. And our third is social, biological, and environmental underpinnings over the life course that shape later life health and well-being. So those are our 3 signature areas. The Trends Network in particular is a network of researchers working to accelerate scientific understanding of old age disability and dementia trends. So this network has explored the causes and consequences of past, current, and future disability and dementia trends, has reviewed findings from new studies, reconciling differences, for instance, between the different studies and populations and the measures, has offered network members a collegial environment that facilitates open discussion of salient issues and cutting edge research. And in addition, we've spearheaded several special journal issues. We would like to acknowledge our founding director, Robert Schoeni, Bob, who I will talk about here in a second, who founded the network in 2016 and led it through his passing in 2021. And it was co-directed and directed by Neil Mehta, who will be joining us for discussion from 2019 to 2025. So in addition to running this network, Bob was a distinguished social scientist. He was a research professor at the Institute for Social Research, as well as a professor of economics and public policy. Bob also was the co-director, PI, and co-I, different titles across the 20 years that he was with the panel study of income dynamics. And he was interested in program evaluation, welfare policy, economics and demographics of aging, labor, economics, and immigration. So we really named this Trends lecture after Bob in memory of him. And so the Trends lecture aims to highlight research on important health-related demographic trends by an emerging scholar. And we chose to do that because anybody who's familiar with Bob knows that he was a very supportive and important mentor for many different scholars, including some of us here in the room, and I'm sure online. The nice thing about talking about Bob is hearing all of the really nice stories and important, how he was really important in a lot of people's scholarly careers. So we really appreciate you joining us today for the first annual Schoeni lecture. So without further ado, let me introduce our first speaker, Mara. She is an instructor at the Department of Behavior, Society, and Policy at Rutgers School of Public Health. She's also a member of the Institute for Health Policy and Aging. Her expertise are in health disparities, aging and life course, immigration, and cognition. And then our discussant today will be Neil, and he is a professor and chair in the Department of Epidemiology, associate dean for research in the School of Public Health and Population Health. And his expertise lie in obesity, cardiovascular health, diabetes, and immigrant health. So please join me in welcoming Mara. Thank you.
Hi, so thank you so much to Sarah for that warm introduction, and I'm really honored to have been invited to give this inaugural Schoeni Trends lecture. Although I didn't have the fortune to know Bob personally, I know his work and also read a lot about him, talked to Sarah, and I'm really inspired by his legacy of scholarship and mentorship, which is one of the reasons I chose the career I'm in, is the mentorship aspect. So just want to honor that and take that with us today. Today, I'm going to be talking about the health and well-being trends among older US Latino immigrant population. It's really meaningful to be in this building giving this talk here at MiCDA because much of this line of my research has leveraged health and retirement study data, and which I'm going to talk about. And I'm really grateful for the work done here to make that available. And so I was actually talking to Vicki about this last night when we met. Some weeks I spend so much time logged into the HRS data enclave that I feel like I commute to Ann Arbor. So it's really nice to be here in person and not, it's just in my little office, like on a computer in Ann Arbor. So in this talk, I'm going to focus on how the growth and aging of the unauthorized Latino immigrant population specifically is reshaping patterns of health and well-being in later life. I'm going to start by talking about demographic and migratory trends, as well as policy changes that have led to an aging in place of unauthorized Latino immigrants. And then we're going to look at the implications of legal status as a key stratifier in the health and well-being trends of older Latino immigrants. And finally, we'll look at future trends. And when I say future trends, I mean within a projection framework, so trends in a general sense. And the work, I just want to make sure to note that the work I'm presenting here, both published and newer, is done in collaboration with Jennifer Van Hook and Ashton Bergery at Penn State and James Bachmeyer at Temple University, and supported by an R01 from NIA. So before I dig in, I want to be clear about the terminology I'm going to be using. There are many terms we all can kind of throw out there that are used to refer to this population. I'm going to be using the term unauthorized and not undocumented. So the reason for that is that while some individuals do fully lack documentation to reside in the US and therefore could be referred to as undocumented, there are many others that have a liminal legal status but do have some sort of documentation. So if you think of those who have overstayed visas, those holding temporary or pending statuses like DACA, like temporary protected status, TPS, those who have pending asylum applications, they do have documentation of some sort, but they are still in a liminal legal status, and we include them when we talk about unauthorized. So this term covers more comprehensively those with some sort of documentation. Okay, so we're going to dive into past trends first. So over the past half century, I would say two population processes have really altered the demographic composition of American society. And those two are the foundation of most of my work, which is aging and immigration. There is an emerging literature on older immigrants, but up until about 10 years ago, the research on aging and the research on immigration largely remained distinct. And this division has been facilitated by one of the persistent conceptions about immigrants, not just, like in a research setting, but generally. And this is what Dowell Myers at USC refers to as a Peter Pan fallacy. So this is a quote from Myers. He holds that people view immigrants, quote, like Peter Pan, frozen in time, never changing and always remaining just like new immigrants, rather than becoming older, more settled, and more successful citizens. And so, in other words, because immigrants tend to migrate during early and mid adulthood, they're generally, when we think about immigrants, we think about young people, but that is a fallacy. So just like the overall US and global population is aging, the US immigrant population is also aging. So you can see that when we look at projections of the US population by nativity. Okay, so this figure uses 2023 US Census Bureau national projections as a base, and then estimates the portion that will be US born, which is in gray, versus foreign born, which is in red, going forward to 2050. And so by about 2035, the US born population 65 and older is expected to level off. You see that the gray bars level off around 60 million. And after that, the foreign born population, the component in red, is going to be driving the growth of the older adult population. We estimate that 20 million immigrants are expected to be 65 and older by 2050, and the Latino immigrant population, which is the focus of my work, will contribute the most growth to this. At the same time as the US immigrant population has experienced aging, Also in the past 30 years, there's been a substantial growth in the unauthorized immigrant population in the US. So these estimates from Hugh show that as of 2023, about 14 million unauthorized immigrants resided in the US. I know we exist in a time of uncertainty, and I'm going to get to that, I promise, at the end of the talk, but for now, let's hold on to like pre-current situation. So 14 million unauthorized immigrants resided in the US in 2023. So I just presented two demographic processes that have been occurring over the past few decades among the US immigration process: the aging of the immigrant population and the growth of an unauthorized population. The intersection of these two trends produces a growing population of older unauthorized immigrants, the largest group of whom are from Latin America. So I visualize these trends here. This figure is adapted from a paper published last year with Jennifer Van Hook. And what we did is we used residual estimates of the unauthorized population in the American Community Survey, and we estimated the percentage of the total unauthorized population, so that's the denominator, that was 50 and older from 2000 over to 2022. And the black line in the middle represents all unauthorized immigrants from all countries, not just Latin America. And you can see that in 2000, on the left, only 3% of the unauthorized population was 50 or older. But by 2022, almost a quarter, 23% of the unauthorized population was in the 50 and older age bracket. The color line on this figure shows select Latin American regions, and then Mexico is in red, and all of which, to a certain extent, have experienced an increase in the unauthorized population 50 and older. So if you look at this, you might ask, okay, well, what's driving that? Maybe people are arriving at older ages. Maybe it's people are undertaking migration at older ages in the first place. So we looked at this. This figure shows the percent of total unauthorized populations that arrived at 50 and older. And there has been a slight increase in the time period we're looking at, from 3% in 2000 to 8% in 2022. But this increase in like older adult migration, taking migration in the first place in older adulthood, does not account for that age structure change that we saw in the previous figure. So for the vast majority of unauthorized immigrants, this is actually a story of aging in place. So this is again from Hugh, and so they look from 1995 to 2016. In 1995, just over a third, 33%, the darker line, of unauthorized immigrants had been in the US for 10 or more years, but by 2016, 66% were estimated to be in the US for 10 or more years. So we're aging in place. And these estimates, like they only go to 2016, but we did these estimates as well. And the average expected duration for unauthorized Latino population is 12.4 years. And more than half of the population has been residing in the US for 15 years or longer. So really, this is a long-term, a story of aging in place. We can see this trend clearly by country of origin by using the same ACS data and residual estimates combined with life table methods. And we modeled age at arrival, which is on the x-axis, and expected duration in unauthorized status on the y-axis. The size, each bubble, and I'm going to label them in a minute, but each bubble is a country, and they represent the size of the unauthorized population from that country. And so the blue represents top left quadrant, represents younger arrivals who stay for a long time. The bottom left quadrant represents midlife arrivals with shorter durations. And then either they're unauthorized for a short duration, or they return, or they legalize, so 3 options. And then group 3 is older arrivals with shorter durations. Okay, so when I label the countries and I limit it only to Latin American countries, you see that the older arrivals kind of disappears, and that most of the biggest sending countries are in the top left region. So younger arrivals with a longer duration and authorized status. And the big bubble is Mexico. And so this really is driving that aging in place trend. We're arriving early and we're staying a long time. So then we want to ask, so why has this happened? Why has there been a change in the age structure of the unauthorized population? And so we need a quick intro to the history of immigration from Latin America to the US with a focus on Mexico as the largest sending stream. So I'm going to take you through this rather quickly, but hopefully not too quickly. So research on the history of Mexico to you. So I'm focusing on Mexico to here first because for so long it was really the largest sending country, making up the bulk of immigrants. So the Mexico to US migration history on the Mexico-US migration shows that until the 19th century, movement across the Mexico-US border was really not considered international migration at all. It was consisted of visits by people who had been part of undivided communities before Mexico surrendered territory along the border to the US. And then even into the 20th century, there was a political, economic, and social hardening of the border, but most individuals migrating from Mexico did not intend for permanent location. There's really, really good qualitative research on this. Instead, they saw economic opportunities in the US as a way to maximize earning potential, acquire capital to reinvest at home, but ultimately to return home. This did decline a bit with the Depression in the 1930s, but in general, migration was circular and what we would refer to today as unauthorized. This was a very common practice. In 1942, during the World War II, the Bracero program was enacted, and that brought Mexican workers to the US on temporary and seasonal visas to work in agriculture to fill wartime labor shortages. And in this way, this kind of solidified the pattern of temporary and circular migration from Mexico. It kind of instituted that as something that could be undertaken. Then Bracero program ended, but changes to immigration policy in the 1960s actually increased the stream of immigrants from Mexico as a whole, authorized and unauthorized. So the 1965 Immigration and Nationality Act, the Hart-Celler Act, if you've heard of it, it removed national quota system and solidified family reunification preferences for legal immigration. These changes not only increased kind of the authorized migration, but just overall increased the stream of migration between the US and Mexico. And by the mid-80s, Mexico was the single largest source of immigrants in the US, and estimates suggest that there were more than 3 million unauthorized immigrants, primarily from Mexico, by the mid-1980s living in the US. The majority of immigrants living here now, age 50 and older, arrived in the US as working age adults in the 4 decades following the 1960s Immigration Act. So this is who we're talking about. The 1986 Immigration Reform and Control Act was passed as actually an attempt to curb unauthorized. We saw, the government saw, we're here. The government saw, there's a problem. Let's try to curb unauthorized migration. So it did many things, but it did 2 things of relevance to this story. First, there was a pathway to migration, to legalization available for those who had come to the US before 1982 and were in the US for 5 years or more at that time. And 94% of those who were eligible for that legalization took the legalization. So there was a mass legalization, which was great. The second thing it did was it hardened the borders. It increased surveillance on the borders, and it also made it harder for employers to hire unauthorized immigrants, penalizing employers. So that was meant to reduce. So we'll legalize those who are here, and then we'll reduce people who are coming in. But it actually didn't work. It hardened the borders so that people still took the risk of unauthorized migration, but now that was more expensive and riskier. So people were less likely to do this circular thing, come seasonally, come for a little while, go back. What is referred to in literature as a caging effect, where individuals came here and stayed longer. And in the mid-2000s, the Great Recession, for a few years, actually contributed to this even more, because younger new migrants for that period came less because there were less job opportunities. So that reduced the influx of younger people, and people started to, who were already here, stayed longer because they needed to recoup this really costly immigration. So, and they wanted to work longer. So taken together, this kind of paints a picture of why we see these trends of aging in place of an unauthorized population. So now that we know what happened, now I want to turn to see how these trends in the aging of an unauthorized Latino immigrant population in the US, what are the implications in terms of health and well-being. And so the big overarching question I'm going to be asking in this second section of the presentation is, to what extent does legal status stratify the well-being and health of aging Latino immigrants? Well, you might ask, why don't we already know that? Isn't it obvious? Like, wouldn't legal status stratify? Like, isn't that, detrimental to your health? So existing estimates of health and overall well-being of US immigrants by legal status, especially at older ages, are limited. First, most studies focus on working age adults and don't include older adults. Many studies don't use nationally representative data. There are great studies that come out of California surveys, like the California Health Interview Survey, the LA FANS, the Los Angeles Family Neighborhood Survey, because those do collect really good data on legal status. But California is a really particular context characterized by state-based health insurance and healthcare access programs for unauthorized immigrants. And it's likely not generalizable to the national level. Third, the reliance on California data is partly, like I said, is because we have legal status there, but in nationally representative surveys, legal status is sparse, unreliable, or just absent. There are some nationally representative research from SIP, the Survey of Income and Program Participation, because they do have some self-reported legal status measures, but the self-reporting can be biased due to high rates of missingness. You don't really want to report your legal status, right? And reporting error. And so some researchers have taken surveys that don't include legal status and use what's called a logical approach to impute legal status from known characteristics. So kind of like participation in public, self-reported participation in public programs, like Medicare, things like that. But there's evidence that this approach also produced biased results on estimates like poverty, health insurance covered, and self-rated health. So that's unreliable measures of legal status. Additionally, most studies rely on cross-sectional data and cannot look at like health trajectories over time. And they connected to that, they do not take into account selection bias. So there's two parts of the selection bias here we want to think about. We want to think about overall health, immigrant health selectivity. Anyone in the world of immigrant health, we know that immigrants are positively selected on health compared to those who don't migrate from their country of origin and compared to the US born. But there's also, we think that there's selection on unauthorized, positive selection on unauthorized population specifically. If you are unauthorized taking unauthorized migration, you tend to be healthier because you're willing to take this risk. And then the last thing is, many studies on health and legal status only look at the single domains of health, self-reported health, limited, and it's possible that legal status operates differently across domains of health. So that's why we need to do this research. It's not done, even though maybe it seems obvious. So that's where MiCDA and the Health and Retirement Study come in. I don't have to tell people in this room that HRS is a premier nationally representative longitudinal survey of middle-aged and older adult population in the US, and that its longitudinal design and the oversampling of Latinos makes it well suited for this research. Additionally, restricted access HRS includes Social Security administrative linkages, which are really, really critical to our measure of legal status. And so I want to be clear. HRS does not collect data on legal status. There is a question, are you a citizen? That's it. We don't want HRS to collect data on legal status. Let's be clear about that too. But what we can do with the fact that these administrative linkages is kind of impute with some certainty legal status. So since Social Security is a universal program for anyone present in the US, especially the US born, when we link HRS data to SSA data, we can assume that those in HRS who are US born and don't link to the SSA records, that's kind of a false negative. They should link. And so maybe there's a discrepancy in the spelling of a last name. Maybe there was a transversal of a social security number when you reported to SSA, or I mean, when you reported it to HRS that doesn't match an SSA. For a foreign-born population, there could also be those kind of false non-linkages that they do exist in SSA, but they're just not linking. Or it could, the error could all actually be that they don't have a social security record and they're unauthorized. So we need to differentiate for the foreign-born between these two types of non-linkage. And to do this, we use a propensity score type of methodology. We compare predictors of non-linking for a US-born population to the predictors of non-linking to a foreign-born Latino population. And then we determine who is most likely not to link because of this false negative, and who is in the foreign-born population is actually most likely to not link due to not existing in the social security data. And once we do this, we're able to classify, and I don't want to say like we have, it's a probability that that a respondent is likely unauthorized versus likely authorized. So to be clear, I just want to be clear, this is a very important point. It's a probability. This is not like you are unauthorized. And we only do this for non-Puerto Rican and non-Cuban Latinos because of different legal status factors for those two groups. And then we also conduct external and face validity of our legal status assignment. And so that's how we get legal status. So now I'm going to talk about what we find when we compare unauthorized older Latino immigrants to their authorized foreign-born counterparts, as well as to US-born counterparts. I'm going to talk about well-being in terms of poverty and health insurance coverage, and then I'm going to talk about physical and mental health. These are intimately connected, of course, and on the federal level, unauthorized older adults faced exclusion from almost every component of the US social safety net, which directly affects poverty and health insurance. And then we'll explore how those structural barriers interact with life course exposures to shape late life health. So overall well-being first. Okay, but if we're going to talk about immigrants specifically, I want to emphasize just how dramatically the well-being in terms of poverty and health insurance has improved for the US over adults overall. Many people here know this well, but it's really important to frame the conversation. So the left figure shows poverty by age group from 1960 to 2020, and that darkest line on the top are the 65 plus group, and you can see a significant reduction in older adult poverty in the last 60 years, and that was a result of the enactment of Social Security as a universal program in 1935. On the right, you see uninsurance rates by age group. That dark line on the bottom is 65 plus, near zero, and has been so since 1965, when near universal Medicare increased access to health insurance for older adults. Okay, the data we have here from the National Health Interview Survey for health insurance coverage only doesn't go back to 1965, but I assure you, if you were able to bring that line back, that line decreases, and that Medicare really improved insurance coverage. The unauthorized population is ineligible for Social Security benefits and for Medicare, even though they actually often pay into those systems, and we can talk about that in Q&A if you're interested. So these policy achievements are foundational to understanding why being excluded from these programs is so consequential. Okay, so now we're looking at how we're going back to the HRS data. Like I explained, we're looking at how legal status stratifies poverty. What we did is we estimated adjusted linear probability models, and we predicted official poverty rates by ethnicity, nativity, legal status, and then plotted adjusted predictions from ages 51 over to 76. And the unauthorized and all my figures are going to be shown in red. And the poverty rates are highest across the age range and increase with age. And this is in comparison to all the other three groups that have constant predicted poverty rates across the age range. And I think most importantly is to compare to this authorized foreign-born Latino group. That's the kind of our comparison group. If we look at supplemental poverty, so supplemental poverty as opposed to official poverty incorporates in-kind government transfers, taxes, tax credits, out-of-pocket medical expense and other expenses into its poverty calculations, and it basically is a more holistic estimate of family unit financial precarity. And so if you look at, you see that supplemental poverty is higher for all groups, maybe with the exception of US born non-Hispanic whites on the bottom, but that they're really high for the unauthorized foreign born Latinos. And this is unsurprising given ineligibility for government programs and higher out-of-pocket medical expenses when you don't have insurance, which the supplemental poverty incorporates into the measure. So poverty is high for this group and is different than for the authorized foreign born. So then our models for uninsurance rates are the similar models, similar controls, similar setup. And here the adjusted predictions show that for the unauthorized population in red, predicted uninsurance rates stay around 60% across the age range. For the other three groups, they plummet and approach zero. We know this is because of Medicare. So this is kind of like an obvious story, right? We just didn't have these estimates because we didn't have good data on legal status. But the story is legal status stratifies access to public programs, which has an impact on poverty and insurance. But the story for health is a little less straightforward to predict. Patterns for health are more complex and shaped by both cumulative disadvantage and potential positive health selection. So just taking you through that really quickly, even though this is a giant literature. On the one hand, we could predict worse health. You can think about working in unregulated jobs across the life course that are involve more precarious conditions without employer-sponsored health insurance. So then this may be associated with lack of preventative care, delayed care for chronic conditions. That's work I do in other spheres, so I'm happy to talk about it. We also know that stress associated with unauthorized status takes a toll on one's health. So that would predict worse health. On the other hand, there's evidence that unauthorized, I alluded to this before, there is research showing that unauthorized immigrants are highly selected on health, that they're positively selected on health. This means that those who undertake unauthorized immigration in the first place and are likely to stay in the country into older ages actually may be in better health selected. There might be there's certainly a mortality bias here. And so they might be among the most healthy and also most resilient populations. And this could actually mean that they're in better health than their authorized counterparts and non-immigrants. So there's a bit of a puzzle in terms of health. So we wanted to look at health selection first. And so what we did is we used HRS to estimate adjusted linear probability models predicting 3 domains of health: functional limitations, persistent conditions, and depressive symptoms. And then we used those to predict health back to age 50, pre-survey. So HRS starts at 51, we predict them, we use post-estimation to predict health back. I'd want to go for functional, we do something a little different here in terms of how we measure these. For functional limitations, so HRS asks about 12 functional limitations. Can you climb one? Do you have difficulty climbing one flight of stairs? Do you have difficulty getting up from a chair? Those kind of things. And so there are 12 of them, and we estimate the percent of the total reported that are reported as difficult by group. For persistent conditions, there's 7 of them. They're like, do you experience swelling of your feet in the last 2 years? Do you have back pain? We again estimate the percent reported by group. And then for mental health, we estimate the percent of the total 8 conditions measured by the CSD depression protocol, mental health protocol, which asks things like, do you feel depressed? Do you feel lonely? Do you experience restless sleep? And the red line again, the red dots are the unauthorized, and you can immediately see that all 3 red dots are on the left side, and that's a lower estimated percent of conditions at age 50. So for example, up here, the functional limitations at age 50, unauthorized immigrants report on average 5.5% of the 12 functional limitations, while authorized in the blue in the middle report 21%, and US born Latinos report 32%. So there are big differences. This is clear evidence of what I was talking about before, a positive health selection for unauthorized population in midlife compared to both their authorized counterparts and US born Latinos in the 3 domains. And I will say for this audience, we are looking at other domains as well. I'm just presenting these 3 here. And I think if you want to ask questions about those, I'm happy to answer. So then we wanted to, okay, so how does this unfold over kind of the life, over older, middle age and older adulthood? So we used the HRS longitudinal data to look at health trajectories with growth curve models. And we have a lot of controls in here that you can see at the bottom, but I want to point out that really importantly, we control for health at age 50. So we control for what the health was at age 50, you saw on the last slide, so that we can separate trajectories from selection. And so these trajectories net what the age 50 health. And if you look at, this is functional limitations, we see that the estimates for the US born and foreign born unauthorized are actually, you can almost not see the difference in the two lines here. And that, and then but for unauthorized Latinos in the red, despite having lower levels at younger ages, increased rapidly into older adulthood. With persistent conditions, it's even more precipitous increase. The growth curves for the US born Latinos and foreign born unauthorized are quite similar and remain constant over the age period, but persistent conditions increase significantly with age for the unauthorized population. And then finally, in terms of mental health conditions, we see a similar pattern, initially reporting better mental health, but over time, symptoms increase more quickly than for authorized or US born Latinos. Again, what we call an emerging disadvantage appears, going from having a health advantage to having a disadvantage, at least in terms of trajectory. So that kind of ends my section on like, what are the implications for this? And so now I want to turn to future trends, like I like to say, but projections of the aging unauthorized Latino population. What's going to happen into the future? Okay, so I imagine you're all like, okay, but all the things you've done have completely changed in the current reality, and that's true. We have had to contend with a lot of our assumptions for many years. Our demographic assumptions have been kind of upended, and even shorter term kind of projections, even if you don't do long-term projections, short-term projections, there's an enormous amount of uncertainty that we have had to contend with. So this is emerging research. It's not even like written up yet. So it's like a preview, and I'm happy to have feedback on it. But what we have done is we know that escalating removals introduce new demographic uncertainty by potentially interrupting the aging in place process the prior projections assumed would largely continue. So we undertook projections starting with the 2024 ACS data as the baseline, using that residual method to estimate unauthorized population I referred to before. I did not unpack for you, but I referred to. And then we project the baseline forward using a cohort component model that incorporates mortality, return migration, legalization, and new arrivals. And we model 3 different enforcement scenarios that vary by intensity of deportation efforts. I want to say that these models assume no new unauthorized migration. That's not something we would have assumed ever before, but all 3 of them assume that. The only thing we allow in the assumptions is that visa overstays. A certain percentage of people who come with a visa will stay. So that we allow, but other than that, there's no influx of unauthorized immigration. The 3 scenarios are going to be presented in black, gray, and red so that you can see them here. The first one is a continuation of pre-2025 removal levels, which was approximately 50,000 removals annually. That's what we would have assumed, for 18 months ago. The second one is elevated enforcement consistent with 2025 removal levels, which we know were approximately 230,000 removals in that year. And then the third is a high enforcement scenario, kind of the political rhetoric that we want to deport 1 million unauthorized individuals each year. We are able to do this work by using age and sex specific differences in rates of deportation from the Deportation Data Project at UC Berkeley. They FOIA'd data from DHS. So that's how we're getting our data on deportation rates. And so, yeah, and the scenarios will be shown in these 3 colors. So this shows the projected number of unauthorized Latino immigrants, 65 plus, who will remain in the US by deportation scenario, projected 20 years. And I want to make clear, when we do that, we're assuming these levels, 50,000, 230,000, and 1 million every year for 20 years. Okay, that's an assumption here. We'll talk about the assumptions at the end. If we assume the pre-2025 levels, so that's the darkest black line, that then by 2045, we estimate that there will be 2 million unauthorized Latino immigrants 65 and older in the US. And that's kind of what we were showing at the first slides, like there's a growth. But even in the most extreme scenario, this would reduce it in half to 1 million, but we're still seeing a doubling, okay, of the 65 plus population. So from about 500,000 to 1 million, it's still a doubling. This is not a population that's decreasing by any sense in terms of sheer numbers. And then when you look at percentage, so since our projection assumes no new unauthorized migration except for via overstayers, the overall population of unauthorized immigrants will not increase. So that's the denominator, right? And especially in these most extreme scenario, we actually see an increase in the percentage of over 65. It will be an aging population because there will be no new influx of these younger unauthorized immigrants. And that's, for the most extreme scenario. So if you think about like the numerator and the denominator in this case. And so even in 2045, under an extreme scenario, like you saw on the other slide, the population is going to grow. I want to say that no new arrivals is kind of unlikely. So the estimates are conservative. We have like not, I mean, I don't know that it's like citable data, but like we know that there are still even unauthorized migrants coming today, not very much declined, right? But there are still people taking that risk and coming to the border. So these are conservative estimates. Also for that most extreme scenario, and maybe even for the 2025 rates, sustainability of such a high level enforcement over 20 years is questionable, fortunately. So especially considering the fact that courts have tended to protect people, especially with TPS and with DACA, lower courts, as well as other people with other special protections. We don't think that it's like possible, and certainly not possible over 20 years. I mean, that's a hopeful, but we really don't. And it could be that the Supreme Court overturns some of these lower court decisions, but the litigation slows down in the deportation efforts. So the red line is really extreme, and we really think that it's going to be somewhere in the middle, like certainly probably not pre-2025 levels, but also not the red line. So the bottom line is the current regime is not going to stem the tide of older adult growth in this population. That's a demographic force that is not going to change, especially considering the age and sex structure of who's being deported. It's not older adults, it's working age males. I can show you slides on that at the end if you are interested. So the reality probably falls between some of these scenarios. And so what I want to do last is I'm going to show you how growth in an unauthorized population may contribute to a decline in overall well-being of the US population as a whole, and why this is such an urgent crisis to contend with and to really have a policy solution to, even though that sounds like a dream at this point. But so what we did is we combined these census projections of the share of the foreign-born Latinos who are unauthorized under, and these projections are still under the pre-2025 levels. We're working on using these other scenarios to do this, but and then we use our HRS predicted probabilities back of poverty and of insurance to estimate how many older adults will be in poverty or uninsured in the US population as a whole in the next 20 years. And so this lets us see how future growth in poverty and uninsurance is attributable to each subgroup. So this figure shows the total projected growth in the 65 plus population in the next 20 years. It started with 2018 here for reasons I can go into, but it's divided up into like the population growth. Like we all know older people, like that the population of people 65 and older is growing. How much can be attributed to foreign-born unauthorized Latinos? And it's only 6%. Most of the growth is going to be coming from US-born non-Hispanic whites. We know that, and other groups as opposed to the three Latino groups. Okay, so only 6% of the total growth is going to be from what we saw before as like this growing population. But if we estimate poverty projections in 20 years forward, the unauthorized Latinos contribute 20% to the overall growth in poverty. And that's because Social Security is not accessible, right? And that's for both the official poverty measure and the supplemental poverty measure. And strikingly, when we add uninsurance rates, we project that they will contribute 64% of the growth in uninsurance rates. So assuming, so uninsurance rates are going to grow, poverty and uninsurance rates are going to grow drastically, and it's going to be driven by this population. So of course, like I said, these assume the current age and subpopulation specific patterns of poverty and insurance hold. That we already talked about how that doesn't incorporate the mass deportations, but it assumes no drastic cuts to Medicare, Medicaid, Social Security. So there's a lot of other things that drive uncertainty here, but this is meant to give you kind of a picture of like what this population is aging, and it is excluded from social safety net, and puts the risk of the improvements we saw back on those obvious slides that we all know about of the older adult well-being into question. So right on time, I think. We're now at some like summary conclusions. So despite the current uncertainty, there is a growing population of individuals who, for the most part, have lived in the US the bulk of their life, like I said, on average 14 years, many of whom have paid Social Security and Medicare taxes through payroll deductions, and they're at risk of poverty, uninsurance, and declining health as they age. So this has implications for unauthorized older adults themselves. It has implications for their children, and it has implications for the US as a whole. So for older adults, lack of access to social safety net programs means extensive precarity. This means that maybe they're making decisions to work past normative retirement age if they are able to, and maybe depend on older adult children or other kin for financial support through reverse transfers, for instrumental help, and other activities that result in substantial caregiving. So those transfers also have implications for the second generation and the third generation. So we know the research on the second generation, third generation immigrants is that it's a story of positive story of integration, of mobility, but it might, by impeding givers' time, education, wealth accumulation, this could change these patterns of social and geographic mobility for second and third generation immigrants in the US. And as we saw from that projection analysis, as the unauthorized population makes up a greater proportion of older adults generally in the US, it also undermines improvements overall in older adult well-being. So, hard to leave you on a negative note, but that's where we stand right now. And I would love to be in discussion with all of you. I'm really excited that I was invited to give this talk. Like I said, some of the research published, some of it's under review, and some of it's like literally we're still in the data right now. So it's emerging, and I think these conversations can, and Neil's comments can have a lot of impact on that. So thanks to Vicki and Sarah and everyone at Trends for this opportunity. And I just want to point out my grant. Again, this is all supported by NIA. And I'm really grateful for my co-authors and amazing research assistants, and to MiCDA, HRS, and the survey participants, which without them, this would not be possible. So, thank you.
Okay, Neil, go ahead whenever you're ready.
Okay, thank you. I'm so disappointed that I couldn't be there in person, but the storms in the Midwest last night threw a big wrench in my plans. But I'm glad I'm able to at least give my comments remotely today. Also, I'm really glad that MiCDA has started these annual Schoeni lectures, so we can continue to honor Bob and acknowledge his contributions. So I'm really looking forward to attending this yearly. And oh, Sarah, you're gonna have to.
Yes.
Yeah. I was trying to do it from here. So wait a second. Okay, so we know, right? Aging today represents unprecedented challenges, rapid growth in the aging population. We have exploding centenarians, the oldest old, rising care needs, shrinking young workers, Medicare and Social Security are in big trouble going forward. And we also have a growing diversity by race, ethnicity, and we'll talk more, of course, about by nativity of our older population. Sarah, next slide, please. So this is the context that foreign-born older adults are aging into, and the racial ethnic the growth in the racial ethnic differences, excuse me, or the growth in the racial ethnic diversity is really a function of the foreign-born population. Right, so the second-generation immigrants, they're still a little bit younger, but most of the increasing diversity is attributed to the foreign-born. Next slide, please. Yep, and this is the slide that Mara presented earlier, and nicely shows here that the foreign-born now are not an insignificant proportion of the older adults. Next slide. And thinking about the older foreign-born population, we have to think a lot about diversity and heterogeneity, right? So we have increasing diversity by country of birth. This is about population, as we heard earlier, that's really a mixture of those who age in place as well as late life migrants. And the health patterns of this group are going to be quite complex, right? So we know about the immigrant sort of morbidity, mortality paradox, where we see higher levels of chronic disease, higher levels of disability among select immigrant groups compared to the native born, but we generally see lower levels of mortality. So when we think about older immigrants and understanding their health and mortality, I think we need to expect considerable heterogeneity in health and social outcomes. And then the other source of heterogeneity is the focus of today's lecture, is that of legal status. Next slide, please. So Mara, thank you. You gave an excellent presentation. I've learned a lot. And I just want to give you a lot of praises. You're studying, I think, one of the most important topics today that social scientists can contribute to. Okay, you're studying a very, very challenging population, and your work and your approaches have been really innovative. Oftentimes, immigrant researchers who study immigrants, we wave our hands when it comes to documentation status, right? And now finally we have some evidence that can guide us. And your projections, again, very challenging to do population projections, we know it, but we have at least some base to start thinking about ways to project this population moving forward. So thank you. Next slide. Okay, just to review the key findings that sort of in my view, one I thought was very striking was that, and these are not surprising, but now we have some numbers, we have some estimates, right? Poverty levels among the unauthorized population are about 4 times that of non-Hispanic whites and other Latino groups. We see very high levels of uninsurance, and I just couldn't help but thinking, is like, if you're over 65 and you don't have health insurance, where are folks getting their health care? I just kept, when I was reviewing Mara's presentation, I was like, my goodness. Sharp increases in chronic conditions and functional limitations by after age 50, but you see very stark advantages at age 50, and I'll sort of return to this point in a couple minutes. Next slide, please. Okay, so I have sort of three comments. The first is around the identification of legal status, and again, Mara, I applaud you for taking this on. I think what I would have liked to have seen is a comparison between the unauthorized population and the false negatives, so those who weren't, like foreign-born who weren't linked, but were sorted into the legal status by the propensity models, right? So I think that, understanding that comparison, I think would be insightful. I think you are picking up something. You are picking up the unauthorized population. I mean, just because of the high levels of uninsurance, right? So you're definitely picking up something, but a comparison of these two groups on the right-hand side for the foreign-born, I think would be interesting. And then did the propensity models produce reasonable estimates of the actual size of the older undocumented population? So what was the distribution that came out of your models, and does that reflect what we know or what we think we know about the distribution of older adults by legal status? And of course, you and Jenny Van Hook has contributed a lot to this area. Validation, how to validate the model, I think is important. Are there any other data sets that you can think about applying this model? Some of the American community surveys are linked to Social Security data, to NUMIDAT data in particular. What could you apply your model there? I mean, these are restricted data, but it would be interesting. And of course, the selection of the undocumented into a census survey and into HRS could be very different, but I think this could be useful. I would have, and I know the papers come out yet, but I really wanted to see a richer description of the socio-demographic context of the foreign-born by documentation status. So poverty is very important, but things like the marital status, education, duration, all the rich variables on health and all the rich social variables that we have in HRS. I think that would have been really interesting to see. Next slide, please. Okay, now to the health findings. So the differences at age 50 were really stark. I mean, there's a difference in prevalence of about a little bit less than 6 times between U.S.-born Latinos and the unauthorized population here for functional limitations, and similar levels of disparities or differences in the other outcomes. How much of this is a function of the model? We have on the right side here, and I was working off an earlier presentation that was sent to me, so I think the figure shown today was a little bit different. But here, it looks like a nonlinear model, and we know some of these models at the tails, can sort of go wild. So is this real? Is your predictions at age 50 valid and real? I'm just raising the question. Yeah, next slide. Okay, with respect to population projections, again, thank you for taking this on, and we know how precarious these sorts of projections can be. Just one comment, and I don't know all the details of how you did it. I learned a little bit more today about using cohort component models and such. But we know that there's these models are very sensitive to the inputs, especially as you go out 20 or 30 years. So one thing that you can think about for each of these scenarios is to have a sort of range of estimates as you play around with the parameters to see, how much sort of variation or how much sensitivity there are in these models. But again, I mean, just to see the sort of first population projections of the unauthorized, I think it's very valuable for the immigrant research literature. Next slide. Okay, so in conclusion, again, very valuable contributions. I think there are many critical methodological challenges. I think Mara's well aware of that. And I think it's okay if the estimates are imperfect. But we should try to do our best with what we have, and today's work is definitely a step in that direction. And I don't know where the data is going to come from, but hopefully this work could be expanded to other foreign-born populations who are aging rapidly too, like Asian Americans and Black immigrants. And I'll stop there. Thank you.